Good afternoon, everyone. We'll just wait maybe another 30 seconds as people start to join us. Okay, so not to delay too much in time, we'll get started and people can filter in. So welcome everyone to our 5th webinar in our technical series of webinars on climate change and health. My name is Amy Savage and I work in the Climate Change and Health Unit at WHO HQ. And this webinar, we are able to delve a little bit deeper into the process of conducting a climate change and health vulnerability and adaptation assessment. So we'll be looking at one specific aspect, which is spatial analysis, including GIS and risk mapping. But before we really get into the content, as always, just a little bit of housekeeping. So we have 2 sessions of the webinar, like with all the webinars. We had one this morning and this one this afternoon. Both webinars are recorded and will be uploaded to the WHO website. So if you wanted to see some of the presentations from this morning, which is generally the same content, but there are some different country experiences shared. So you might want to look at the recording from this morning's later on. And I will just share the, sorry, my PowerPoint's a little bit slow. Share the schedule of the webinars. Here they are. You can get them on the website. You could scan the QR code here or the URL is there, but you've probably already seen it considering that you're here. So we have the next webinar on the 10th of July on climate resilient and environmentally sustainable healthcare facilities. And as always, if there's any other specific topic within climate change and health that you would like us to cover, please just send us an email and we'll look into that. We do have simultaneous interpretation for the webinar this afternoon. It will be English, French, and Spanish. So if you need interpretation, there's some instructions on the screen here, and I encourage you to set that up now. And also just to note that our last presentation will be in French. There'll be English presentation slides, but the actual audio will be in French. So if you are listening to the webinar in English, just be ready for the last presentation to set up your interpretation. A quick overview of the agenda. In a moment, I will hand over to our unit head at the Climate Change and Health Unit, Dr. Diarmid Campbell-Lendrum, to open the webinar and to set the scene for the rest of the presentations. We'll then have Dr. James Chirombo, a biostatistician at the Malawi Liverpool Wellcome program, to give us an introduction to GIS and risk mapping in climate change and health V&As. We will then have David Ogier, who will be sharing his experience in utilizing spatial analysis in the climate change and health vulnerability and adaptation assessment for Nigeria. We'll also then hear another country experience with Dr. Etienne Kouakou, who will be sharing the experience of Côte d'Ivoire. And then finally, if time permits, which hopefully it does, we will have a discussion and Q&A. So we'll be able to ask some questions of our presenters. So without further ado, I'm very pleased to hand over to Dr. Diarmid Campbell-Lendrum. Thank you.
Thanks so much, Amy. A real pleasure to join you all today. We all are in the 2020 thing of, can I check that people can hear me? Can I check that people can see my slides?
Yes, and yes.
Brilliant, fantastic. Then I'll continue. So once again, thanks to those of you who have joined, and also to the team organising this series. And just to underline this point, that this is one webinar within a comprehensive series. So we really are encouraging you to look at the programme as a whole. But this one is a little more specific than some of the others. But we think is a critically important technique that we already see widely used in climate change and health work in general, including particularly within the vulnerability and adaptation assessment process that we are promoting and supporting from WHO. So, although climate change and health is still considered to be a relatively new topic, the idea of using spatial display and spatial understanding linked with climate information to understand health problems is as old as Western medicine itself. This is a quote that we've been using for many years within our program by Hippocrates, the father of modern medicine, at least in the West. And as you can see from the quote, he was already articulating how you needed to understand both the weather, climate, and also its interrelation with geography if you want to understand why whether people are going to be healthy or what health issues they may suffer from. Also bringing it a little bit closer to the present, in the study of epidemiology and public health interventions, one of the central references is John Snow's work in identifying the source of the cholera epidemic in London in the Victorian era by basically mapping where cholera cases were occurring, using that to zoom in, if you like, on where the problem may be coming from, and identifying the pump and the pump handle that was then removed in order to stop the epidemic. So this is one of we think of it as one of the earliest forms of GIS analysis. So the power of the tool has been appreciated for a very long time. And now to bring that into connection with what we're doing in order to support work to protect people's health from the impacts of climate change, you will be, I'm sure, familiar with the concept of health vulnerability and adaptation assessments. Hopefully, you may also be familiar with the technical guidance that we've produced on this, going back more than a decade, recently updated. And we have appreciated that geographic information system techniques are a very powerful tool to support the delivery of a good and informative vulnerability and adaptation assessment. So we can use GIS at different points in the process, which is outlined in this guide. The most important point at which this is used is within the actual vulnerability assessment itself, in what we describe as step 2, to identify trends in upstream drivers and the geographic distribution of risks, to identify where there are people who are likely to be particularly vulnerable to the impacts of those changes in drivers, but also as a way of documenting the current situation and monitoring changes in the situation going forward. So that's the stage in the process that we think GIS is most relevant. And if you'll excuse us for the slightly odd ordering, so we've gone from step 2 back to some of the other steps, but just to point out that in other steps in the assessment, GIS can also have a role as well, both in scoping out the assessment to start with, also in assessing the capacity of the health system and other systems to respond to the challenges that are being identified, and also looking forward to assessing the future risk as well. So just to underline again, GIS is relevant at various points within the process. We think particularly within what we have described as step 2. I'll now just quickly, by way of introduction to the issue, just to take you through a series of examples which have already been documented in existing vulnerability and adaptation assessments. So this is not us saying it could be used for X, Y, and Z. This is countries who have already used it for different stages in the process. And I would say that our aim with this webinar is both to increase the understanding of people about how GIS can be used, to promote its adoption in more countries, in more vulnerability and adaptation assessments, but also, as you'll hear in the other parts of the webinar, to basically go a little bit deeper and give a little bit more technical information and support about how this technique can be applied to different parts of the process. But the point I'm making in the next few slides is just it can be done and is already being done. So in this example from Bhutan, a country we've worked with closely for probably about 15 years now, right from the start, GIS was used to identify the study areas in which the project team wanted to look at the relationship between climate and weather information and health outcomes, including diarrhea, malaria, and also the health impacts of extreme events. This is quite a widely used technique in this early stages of the process. Another example is in the vulnerability and adaptation assessment from Uganda, where the districts for study were selected based on the past occurrence of health hazards, actually the physical health hazards, drought, storms, floods, and extreme temperatures. So it's being used right from the earliest stages in the process. So hopefully you can see that it's being used to identify areas that have particular health problems. It's being used to identify areas which have particular exposures to weather and climate hazards. It can also be used to, if you like, stratify the assessment or the study so that it's possible to get a good and comprehensive picture of the way in which climate and health interact in different parts of, in this case, the country. And many countries will have a good understanding of the, within their own country, you may have different bioclimatic zones or ecological zones. So part of the country may be drier, part of the country may be at higher altitude, and so on. And so we also see countries using GIS to describe these zones so that when they start the work on the analysis or the full assessment, they're getting representation of these different zones and the different health challenges that may occur differently in each of those zones. And in some cases, combining the information. So there's both information on the climate zones and also information on the different health impacts that occur in different rates in those different zones. So these are a series of illustrations of how GIS is used right from the start to orientate the rest of the study. Moving on from that first sort of scoping stage and looking at the actual vulnerability assessment itself, and another example from Mozambique, who has done a lot of very detailed work now on climate change and health. It's used not just to identify where you may want to start to study the problem, but actually to get a comprehensive picture of the distribution of the exposures or the risks. So in this case, they were able to produce maps of variation in temperature, means and variation in rainfall, means and variation in relative humidity, for example, based on historical data, because it is known that those are conditions which affect some of the health issues for which that country is most concerned. And again, we see countries both combining information on the hazard, but also combining information on the vulnerability or the health outcome. So this is an example from Guinea, where they're mapping temperature, they're mapping precipitation, they're also mapping overall measures of vulnerability, and they're also mapping vulnerability in relation to specific diseases. For example, in this case, malaria. And hopefully you're getting the picture that one of the ways in which this is most commonly used is simply to visualize the problem. And it may seem obvious that that's what GIS can be used for, but we do know that providing maps, providing visual representation of a problem is often much more engaging and much more explanatory to a policymaker or to the general public than providing them with text and figures and so on. So that's actually a basic but a very core part of the utility of geographic information systems in this context. We also see countries who have carried out a certain amount of analysis and are then using GIS to visualize overall vulnerability to the health impacts of climate change, and using that to prioritize their deployment of resources, either to study the problem in more detail or eventually to actually deploy interventions. And so Ethiopia, for example, has done quite a lot of work on defining an overall vulnerability index, mapping that index in order to identify which parts of the country probably need most attention in terms of protection from climate change. I perhaps won't dwell on this. This is basically the same idea again, but it's that combination of both the weather and climate risk, the sensitivity of those conditions to these climate conditions, and also the capacity for responding to climate variability and change. And ultimately, what we're trying to do is to increase the capacity of a country, but also particular parts of a country, to protect their population from climate change. So as you can see, we're starting to really get to the goal of the whole exercise, is that we're identifying where we have an opportunity to raise resilience and to raise adaptive capacity to the health impacts of climate change. Moving forward then further, I've given quite a lot of examples for that stage 2, which we think is probably the main area in which it can be used. But if we want to understand the capacity of the society or the health system to respond, we can also use GIS for that. And so this is an example from Nepal, where they were using quite routinely collected data on, for example, levels of education, availability of resources, the availability of health services, livelihoods, and so on, as an indicator of the overall adaptive capacity. In places where the socioeconomic and the health conditions were low, they were then using GIS to visualize that, because they consider that interventions are probably going to be most important in those areas where these conditions are not good and therefore need to be strengthened. And then the final example that we wanted to give is the forward-looking aspect of this. So everything that I've described up until now has been based on interpreting and displaying historical data or recently collected data on these different conditions and their spatial distribution. But it's also, of course, possible now to do forward projections of hazards, or even the combination of hazards and vulnerability factors. And of course, that also has a spatial component as well. That whereas we may say the world may warm by 2 degrees on average over the course of the century, if we don't mitigate enough, that average means something different in different countries in different parts of the world, but it also means something different within individual countries as well. For example, you may see parts of the country expected to increase a higher degree of temperature increase or a lower degree of temperature increase, or where precipitation may be expected to increase or to recede. So it can also be used for this forward-looking component of the vulnerability and adaptation assessment. So just to sum up then, our very broad overview of where we think GIS is useful and has been used. We think it's useful and has been used to identify the study areas in order to start your assessment, to map the spatial distribution of the hazards, the exposures that populations suffer and their vulnerabilities. It can also be used for data analysis to understand the correlation and potentially the causal relationship between weather and climate variables and health outcomes. So, for example, we may see, we know, for example, that we see in many parts of the world malaria, lower exposures to malaria at high altitudes than we do at low altitudes, because it's cooler, and you can use that relationship to carry out the analysis to work out that correlation between temperature and malaria, for example. We also can use it to understand trends, both in the past, but also projected into the future. And this point that I've already underlined, to display complex information in a simple visual form, which can be engaging to stakeholders of many different kinds. And that then links to communication and advocacy. And ultimately, all of this has the aim of supporting decision-making, supporting better public health policy. Just a comment on where we think we are in terms of the use of this technique already in vulnerability and adaptation assessments. As I've said, all of the examples so far that I've presented are ones where it has been used. This is not us giving hypothetical examples, but we see that for the most part, they're mainly used to visualize the current situation, base data. They're not so commonly used yet for geographical data analysis to get a better understanding of the problem or for future projections. We very much endorse and appreciate the way that they're being used up until now, but part of the reason for holding this webinar is to also encourage people to use GIS techniques more widely on those analytical and forward projection steps, because we think they're very powerful there as well. So with that, thank you very much. Thanks very much particularly to Carlos Corvalan, who's done most of the work on this, and I just get the opportunity to present it. And with that, I'll hand back to Amy.
Thank you very much, Diarmid. Now that we have a little bit of a foundation of where we might use GIS techniques in the process of a climate change and health vulnerability and adaptation assessment, I'll hand over to Dr. James Chirombo, who will give us a bit more of an introduction to GIS and risk mapping, including in vulnerability and adaptation assessments. Thanks, James.
Thank you. I'm going to give a brief overview of GIS. So this will be a very basic presentation. Some of these concepts are probably well known to everyone here, but I guess there's no harm reminding ourselves of what GIS and risk mapping is all about. So hopefully through this presentation, we'll be able to understand some of the key terminology that are associated with GIS and risk mapping, but also point us to some of the more common sources of spatial data that we can use in our work. So as an introduction, with spatial data, let's start with spatial data. This is just data that is associated with a geographical location. So we are starting with this definition of spatial data because for GIS, for us to talk about GIS risk mapping, we need to have data that is geographically indexed. So a good way to start is defining what spatial data is. So this is any data that is attached to a geographical location. And this could be maybe through latitude and longitude. When you have a point, you can have a lat long for it, or an entire administrative region or district. So data that is attached to that district still qualifies as spatial data and can be visualized in a GIS. So a GIS is just a computer program. It's quite a comprehensive and complex program designed to handle this spatial data, which allows us then to visualize the data, do data management, all sorts of things that we would like to do with the spatial data, whether it is merging, transferring from one data source to another, creating new variables, doing data analytics. We can all manage to do all that within a GIS. And lastly, we can do spatial data analysis within a GIS application. So in terms of software, there are a lot of softwares around. The examples that I'm going to give in this presentation, they are mostly based on Quantum GIS or QGIS for short, which is a free desktop application, There is ArcGIS, which is a commercial, but there are others. Some other software and programming languages like R, they are also GIS in their own right. They have good capabilities to handle spatial data and allow us to do spatial analysis. So that's another option, even Python and others. So there are a lot of possibilities in terms of software. But for QGIS, I'm going to use that mostly in these examples, and it has got base functions, and it has got some additional plugins that you can install to extend this functionality. So it's a relatively easy application to use, and it's quite powerful. It can do almost everything that we need in our work. Now, going back a bit to the spatial data, now this time looking at the types of spatial data that we usually talk about in GIS. There are basically two of them, vector data and raster data. So I'm going to go through each one of them in the next few slides. So starting with vector data. So vector data is a type of spatial data that is used to display or represent points, lines, polygons. And this could be used to represent features like household locations. For example, you can use points to represent a location of a house. A polygon can be used to represent administrative boundaries, whether national boundaries, subnational boundaries, and so on. Lines, you can think of lines maybe to represent things like rivers, road networks. So all these will be under vector data for representing spatial data. Now, when it comes to working with the actual vector data, usually the data will come in a format known as a shapefile. And most of you have probably used shapefiles at some point. So it is made up of several related files, and you need all of them to have to work properly with the data. The data will have an extension .shp. That's the shapefile itself. And this is the file that is going to store the geometry, whether it's a line, a point, and so on. But related to it, there are other files with extensions like .shx, dbf, for example, for storing attribute data associated with your geography or your geometry. So just take note of that. If you have data that is missing, it might not work properly in a GIS. So you need to have all of the related files for your shape files. And just to mention here that shapefile is quite an old type of vector data, but it's still commonly used. But recently, there's been development of formats like GeoPackage and GeoJSON, for example. So these are just some of the newer types or formats for storing vector data. But you are most likely to work with shapefiles where they are so widespread, even though it's a relatively old file format. Now let's remind ourselves about raster data. So this is the second type of spatial data. It's also known as a grid data. So it's quite different from the vector data that we just looked at. So the raster data are used to display information that is continuous over space. Unlike vector data, for example, if you go back to vector data, you can use it to represent features like rivers, households. So those are not continuous features, they are kind of discrete over space. But when it comes to displaying continuous data, then you have to use raster data. So an example for continuous data could be maybe elevation or even humidity or temperature over space. The entire geographical space will have associated with it some measure of humidity. So you can have raster data to represent the entirety of that space with the attribute of interest. So to achieve that, you have to use a matrix of pixels or cells. So each cell will represent a value that is on the ground. So a particular cell in your matrix is going to represent a value, and it's going to have a value attached to it. So if you look at all of the cells together, then since they are all side by side, you are able to represent the continuous data nicely. This next slide can shed more light. So suppose you have your grid. For representation, we're only showing a single pixel with data shaded in green. But if this was complete data, then all these little squares would have a value associated. So we would have different types of colors to stand for different different values. So you end up with a feature that changes color depending on exactly where you are and what you are representing at that particular point. So that's how raster data is represented. Just to recap, this is for displaying continuous data as opposed to the discrete data in the case of the vector spatial data. Now, to obtain still under raster data, to obtain it, usually there are two ways that are typically used: the satellite imagery and aerial photography. And these two methods together, they form what is known as remote sensing, which is just the process of capturing spatial data using either aerial or satellite imagery. And also, just to mention here that the size of the cell that we show in the previous slide will determine the spatial resolution. So the amount of information that you want to represent can be given by the size of the cells. So on the satellite imagery, this is given by the satellites that are orbiting the Earth at a very high altitude. So they do capture pictures of the Earth from that altitude. For example, vegetation. Vegetation varies continuously. If you look at a piece of land or a country, the vegetation is going to vary. You can have some green forest, for example, it will turn into bare land somewhere. You can have some savanna land and so on. So there is a continuous, it's kind of a continuum of this satellite imagery process is able to capture these and to present these changes in the vegetation using raster data. For aerial photography, they are commonly being used nowadays. The advent of drones, we've got drones that are fitted with cameras, and as they are flying over land, you can take high-resolution pictures of whatever you want, whether it's a flooding extent, vegetation, and so on. So they are coming quite accessible in terms of access to satellite data. This is just an example of how raster data would look like. If you plot it in a GIS, it's going to look like this. So notice how the attribute in the background changes smoothly. From one value, it just changes smoothly from one value to the other. There are no proper boundaries, so to speak, like one value, then you go to the next, just varies smoothly. Since we are talking about a value that is continuous, so that's what you would expect, that it would change just continuous. We don't have solid boundaries from one feature to the other. Another point that I wanted to maybe remind us of is the GPS, or geographical positioning system. So this is basically what allows us to assign geographical coordinates to our own data. So the example that I just mentioned about, I think of a situation where you are getting satellite imagery from a satellite that is orbiting the Earth. This will provide satellite images that cover the entire globe, but you might be interested in a particular land where you work. So all you need to do is assign geographical coordinates to that raster, for example, in a process known as georeferencing. So you want to extract from the raster data, you want to extract the extent that you'll be working with. So we do use GPS receivers to have these coordinates to allow us to have a pinpoint area to work with. And these can be collected during data collection. And these days, surveys are almost all the big surveys that are taking place, even at national level, they are also collecting geo coordinates, whether it's households, geo coordinates for hospitals and so on. So these days, I mean, there's no shortage of spatial data. It's readily available. You can also obtain it from other service providers like Google Maps. Google Maps, for example, you might be able to extract coordinates to match your location if you are unable to have them on your own. Right, now this leads me to this slide, which just highlights some of the common sources of spatial data. There's humanitarian data exchange. This is a freely available platform. People share data, and you can find all sorts of data from climate data, disease data, geographical data. The list is endless. The data is all available there. If you want to do risk mapping, then at some point you need to have spatial data that captures administrative boundaries. So depending on the level of mapping, your spatial area of interest could be districts, countries, regions. So this website, the second bullet point here, will give you access to official administrative boundaries for almost any country in the world. And within each country, you have multiple layers. You can have level 1 boundaries, level 2, level 3, depending on the sub-district administrative units of that particular country. I think level 0 is national boundaries. You can have level 1 and so on. So you get all you need to do risk mapping, because it's not possible for individuals to collect on data as far as national boundaries are concerned. So we have to rely on official data that is already provided out there. There is also worldcrim.org. There is climate data there, most recent form of raster data, so you can also use that. There's WorldPop. WorldPop hosts a lot of population data, population indicators, that can be useful when we are doing risk mapping. So it's worth visiting as well. Now let me move to mapping for climate change and health V&As, and I'll just talk about maybe some of the things that you need to take this process forward. So starting with the data needs. So you would need to have access to disease incidence data. So depending on the climate sensitive disease or outcome that you're interested in, you have to have access to that. And since we are talking about climate change, it helps to have a time series, maybe that dates back to as long as possible, so that you have got strong signal of the relationship between the disease outcome and the climatic variables. You might also need to have access to some data, which I'm calling covariate data. So including the climate data itself. So how does the disease outcome change with climate data? But in addition to the climate data, there might be some other factors that are possibly affecting that interaction. So it might be important to take account of them in your analysis. Whether you're building statistical models, it might be a good idea to control for any possible socioeconomic indicators, and really any other data that can potentially affect the disease outcome. It has value to take account of them in the data analysis. And lastly, yeah, it's the usual, I mean, the spatial data, you need it at the required scale to do the risk mapping using the different sources that I just highlighted in the previous slide. Now, once you have identified the data sources, then the next step is probably you need to have a combined data set, because mostly you are getting data from so many data sources and you can't use them as they are. Somehow it's nice to have them in a single database. So you have to integrate the data, both climate and non-climatic, but also the disease data into a single data frame or data set. Then that's going to allow and facilitate the discrete statistics that you might want to do on the data, like checking whether there are associations between a disease and climatic variables or socioeconomic variables, doing all these statistical tests to have an idea of the strength of the association before you can move forward and do the mapping itself. In addition to the descriptive statistics, the next thing really is to dig deeper and to understand how your disease outcome is changing depending on the other data sets that I've talked about. So if it's malaria, for example, how is malaria incidence changing with changing temperature patterns, changing rainfall patterns, or changing population density, and so on. So you can build that into a model. Can have a model for rates if your data are counts. For example, you've got counts of malaria cases at a district level, then you can fit models for count data. You can have models for binary data. So depending on the type of data, there are so many options in terms of the model that you can have to estimate the strength of the relationship, but also to predict. I think that's another important aspect of risk mapping for V&As. You want to be able to predict either going forward into the future or predict within the observable period, but you might be predicting the value of your outcome in a location that was not sampled or location that has got no data. So that's also another kind of prediction. So which I would just call spatial prediction in this case. In the end, you want to have an idea of the changing landscape in terms of your disease outcome. So are there any hotspots that you can identify, which are areas that have got elevated risk of transmission, for example? So GIS can help us shed more light on the disease incidence and prevalence at whatever scale we choose, depending on the data that we have. Now, in the next few slides, I will just talk a bit about some of the work that we have done in Malawi around cholera and malaria, using some of the techniques that I've just highlighted. So a bit of a background on cholera. So this was motivated by the recent outbreaks that we had in Malawi. We had cholera outbreak for almost 2 years, maybe 2 years, really. And unlike in the past where you would only have maybe outbreaks during rainy season, this time around it was quite surprising that the outbreak ran throughout the entirety of the year, whether it was dry season or wet season, and into the following year as well. So there was quite a lot of data that we could work with. And this is how the data looks like in our case. And I think for most of us, this is the kind of data that you usually get from public health offices. They will record data like this, a number of cases, there might be deaths recorded, the location, in this case, district, and the date. So how can we use data like this to visualize in a GIS? So the first thing that we did was just to aggregate the data. Was as it is, you only have each row is representing a single case, but we want to have an aggregate of all the cases at the district level. So you can easily do this in any application, whether it's Excel or a statistical program such as R to summarize the data, group the data, summarize. Then after that, you can export it to GIS, to QGIS, and merge it with the underlying spatial data that you have from your sources. So in this case, what we did was to aggregate the data at district level, then merge it with the district spatial data, so that now the data becomes spatial data. Instead of just having cases, now we are attaching the cases to some geography behind, so that we can now do the mapping. And after a simple analysis would produce something like this. So here I'm just showing the cases in 2022 and 2023. So a simple map like this can help you just appreciate how the malaria, the cholera burden rather, has shifted between the 2 years. So if you look on the northern side, there's quite a high burden, high number of cases in 2022. Then in 2023, we see pale colors showing that the burden has gone down. And mostly it's kind of shifted to the center and south. So this is something that you can work out from the data once you have visualized it in a GIS. A similar map can be generated for the cholera deaths. Again, we see a similar pattern. A lot of deaths are reported in the north in 2020, 2022, 2021, 2022, but 2023, the picture has changed. Now, most of the burden is going to the southern region. So that's a very simple use of data that is publicly available, but you want to present it in a way that can help people to quickly look at any patterns, and GIS is one such tools to use in this case. So in this time, I'm going to move to malaria. So this is another data that we had, but for malaria, it's just a single district. So in Malawi, we've got 28 districts. We just did this for a few districts. I'm just going to show for one district, which is the capital city of Malawi. So the goal in this analysis was to identify areas of elevated risk or hotspots for malaria. So using data from past surveys, point reference surveys, and in this case, we added rainfall as a covariate. And how can we picture and visualize the possible presence of hotspots if we have this kind of data? So remember, what we have in this case is data sources that are discrete. We've got points, each point representing a survey. So I've got prevalence levels at different points. But in the end, we want to have the entire district under some kind of a surface that you can use to work out any possible hotspots. So in a way, we are doing spatial prediction. So in areas where there was no point survey, we still want to attach a value to those locations. So you can use spatial modeling techniques to extend the results from the discrete points and extend that across space. So in the end, you end up with a figure like this. So the inset map just shows the location of the district within Malawi, but notice how the figure changes, the value changes, the value of prevalence. So I've got some areas of elevated risk or prevalence. I've got some areas with low values. So it's quite heterogeneous across space. And this is what you want to see. You want to have to be in a position to say that, okay, in this corner of the country, maybe the risk is high. Let's do things differently instead of just having a single value for the entire district, for example. One could have easily said prevalence in this entire district, let's say it's 20%, but is that 20% equally distributed across the entire district? So with risk mapping, we can be in a position to work out exactly where the high risk is and where the low risk is to help our public health people to apply the necessary interventions. Now, in conclusion, I hope we have reminded ourselves that GIS is really a tool that can help us to visualize trends in disease outcomes. And to achieve that, we need to have spatial data to allow us to do the mapping. We need to combine the spatial data with the disease data and bring all this into a modeling framework. So we're going to talk more about quantitative methods. I think there's a webinar in the next month, I think, about quantitative methods. So talk more about the actual modeling techniques, but modeling is really key to understanding the presence of hotspots for mapping. So I'm going to stop here and hand you back to Amy. Thank you very much for your attention.
Thanks so much, James, for introducing us to some of the key concepts and considerations for GIS and risk mapping, and for sharing some of the experiences of using those tools and methods in the V&A of Malawi. I'm now really pleased to introduce David Ogier, who will be sharing his experience using spatial analysis in the Nigeria climate change and health vulnerability and adaptation assessment. Thanks, Dave.
Hi. Hi there, everyone. Good afternoon. Good to finally be presenting this. Thank you very much for having me. My name is David Ogier. I'm a climatologist, disaster risk specialist and GIS specialist based in Cape Town, South Africa. I'm going to walk you through some of the examples that I recently did on the Nigeria health, climate change and vulnerability assessment. Hopefully that all makes sense. So as was shared, I think in the earlier presentation today, when you are doing any sort of analysis, planning your work is probably the most essential part, and it's doubly true when it comes to GIS. For the most part, the GIS steps that require the most planning are steps 1C, D, and E. Step 1C, there are 9 major health outcomes to consider, or health risks to consider. You need to decide, are you looking at all of them? Are you doing a subset based on country priorities? You also need to consider the geographical extent. In the case of our project, it was the whole country of Nigeria. And the time extent, we looked at 2 timeframes, the historical timeframe of 1990 to 2020 as the current base period, and the future 2020 to 2050 as the future period. And we used SSP 2 4.5 for that climate. Step 1D. So obviously you need to engage the stakeholders, but you also need to make sure that all of your analysis is reflective of the people that you actually want to address. And we'll look at some of the classifications that you can use to make sure that that is indeed the case. Step 1E is gathering all of the data. As GIS specialists, we often love to gather all the data first, but just make sure that you're gathering the right data and make sure that it's actually going to be useful for the assessment. So in terms of GIS data for these assessments, health data is very difficult to come by very often, and it's sometimes not in a very good GIS format. Sometimes you need to do some data wrangling to get it into a GIS format. Climate data is actually in pretty good format in a lot of cases. I think some of the sources have been shared. I very often use Wellcome or NASA data or Copernicus. The vulnerability factor data is essentially the wild card. It varies between organizations. Some are reputable, some are less so. But yeah, some of the better ones are World Pop, UN, FAO, UNESCO, and a few others like that. The structure of the health and vulnerability assessment can be taken from the WHO framework. I highly recommend looking at that document. It has a lot of detail, and it's probably the best I've seen it summarized to actually be useful and tangible. However, every assessment that you do based on the requirements that are needed for the individual project the stakeholders, the data available will change the nature of the assessment, and the structure might change somewhat, but it's a very good baseline, so I'd recommend using that. It does describe the current and future climate hazards as the overarching drivers. It also has vulnerability factors like healthcare capacity and community vulnerability, your exposed populations, as in which people you're wanting to work with, and how that relates to disease prevalence, for instance, and then how all of those come together to create the health outcomes, which are essentially the health risks. Apologies, I do work in a lot of different fields, so I do sometimes get the terminology mixed up, but this is how I tend to understand it. And it is quite similar to the IPCC AR5 methodologies for climate risk assessments. So a few discrepancies, but mostly the same. One of the big challenges when it comes to doing these assessments is the selection of indicators and grouping them by health and health outcomes or health risks, for instance. So if you take the example of waterborne diseases versus malnutrition, there are very different climate drivers changing those risks, as well as community vulnerabilities, healthcare capacity, and disease prevalence that will essentially change the scenario on the ground. So if you look at informal settlement that is frequently flooded, and that area will be much more susceptible to waterborne diseases than, for instance, a rural agricultural area that relies on rain-fed agriculture. Whereas the second example would be more susceptible to malnutrition, for example. So it only makes sense then that the different factors that are used to calculate the different health outcomes, so the waterborne disease risk and the malnutrition risks, the indicators that go into those analyses should make logical sense in terms of reinforcing or decreasing that particular risk. So if you look at the climate risks for waterborne diseases, you see things like rainfall seasonality, average and maximum temperatures as examples, whereas malnutrition looks at annual rainfall, drought, aridity, consecutive dry days, and rainfall variability. The community vulnerability as well would be different between the two of them. So water stress and flood sensitivity versus reliance on agriculture, irrigation types, and malnutrition index. So all of these indicators should present a unique set of indicators for each one of the different health outcomes in order to give a tangible and meaningful outcome for each of the risks. So this is just an example of the health outcomes for the community vulnerability indicators for waterborne diseases and malnutrition. So in terms of waterborne diseases, we looked at water stress and flood sensitivity. Combining the two of those gives you a community vulnerability index for waterborne diseases, whereas combining reliance on agricultural livelihoods as well as rainfall reliance for agriculture, combining the two of those gives you a malnutrition community vulnerability index. So what you essentially end up doing is creating community vulnerability indices for each one of the climate, for each one of the health outcomes and the climate hazards as well as the health capacities. So you end up with a large number of indices that you will then use to calculate the final risks. So other examples might be respiratory health can combine indicators of particulate matter in the atmosphere and fire density, as well as TB prevalence, for example. Climate hazards for injury from extreme events might look at 1 day maximum rainfall versus days over 20 millimeters and coastal flood risk, while heat-related illnesses might combine maximum temperature days, warm spell duration, days above 35, and hot nights. So essentially grouping or selecting and grouping all of these indicators relative to the health outcomes will essentially help you build the logical framework of the assessment that you're trying to do. So when you do start doing the assessment. Step one, I think this was alluded to earlier, you need to decide on the structure of your data, whether you're going to be using raster or vector data. I think James was mentioning that earlier. There are advantages and disadvantages of each. I prefer raster just because it gives generally a higher resolution. The analysis is quite a bit quicker, but changing things later does become more problematic. Why I enjoy it the most is because when I've made a mistake, it's very obvious that I've made a mistake, whereas sometimes that's a little bit harder to do with vector data. But vector data, on the other hand, does allow for recalculations to be a lot quicker. So essentially, whichever one you use, try to stick to that as best as possible, or as much as possible, just because it'll make your analysis a lot faster. Also make sure your data is all in the same projection, and resample as needed. The second step is classification and standardization of the data. A big problem when it comes to different data sets, whether it's population, whether it's flood indicators, whether it's anything that has a particular extreme outlier, is depending on the resolution of the data, there might be a lot of nothing and then very small areas of extreme events. So if we look at the population data of Nigeria, we can see a few small hotspots of high density population dotted around the country, and the rest of the country, the rural areas, it's all lost if you look at the actual scale of that population. So one thing that I do like to do is define a classification that highlights the areas that I do need to suggest, or I do need to be cognizant of. So in this case, I need to look at a lot of the rural areas because there are people too there. So I use a classification method, either Jenks classification or something that essentially represents the majority of the spatial area, such that you are able to take it into account. And I very often, this I normally use for pure mapping purposes, just because it does show the data quite a bit better. But once you've done that, you can also use that same classification for the risk calculations. But in order to do that, you need to have them all within the same scale. So I would then standardize all the data by this modified classification. I normally standardize 1 to 100, 1 being the best case scenario, or the areas that have the smallest impact on health risk, and 100 being the areas with the highest impact. But you can change that 1 to 10, 1 to 5. You can also do qualitative scoring of low, medium, high. Just bearing in mind that you will change the resolution of the data based on how you do that. Okay. And the final step is actually bringing in all your data. So this is just an example of malnutrition. And this is historical data as well as projected data. These top ones here are the climate inputs. So the 5 different climate inputs that I used for the climate hazard result in this climate indicator. The population I have there. Malnutrition based on community is things like reliance on agriculture, as well as irrigation trends, as well as we've got agricultural yield sensitivity. And then some of the diseases noted were either stunting or children underweight. And these all created these indices in the center here. The same is done for projected. Again, these are anomaly climate changes, but to make the actual indicator, use the actual, not the anomaly, obviously. And then this is just a future projection of population. So the indicators are based, sorry, the indices are based on the individual indicators. And in terms of doing the calculation, it varies sometimes. I think there was an earlier presentation where it was quite a complex calculation. That depends very much on the project, the data availability, and if there's any weighting based on expert opinions. For the most part, you can either do an average or a sum or a multiplication. Just be sure to document those noted changes, and yeah, correct the scale at the end when you're doing that. So what you'll eventually get is you will get current and projected risk indicators for each one of the different climates, so each one of the health outcomes. So in the case of this project, the client said we want all the health outcomes done, so that's what we did. You can see a general trend that a lot of the red areas are in the north, just because there's a lot of development needed in those areas, and that was pulled through in some of the community vulnerability and medical capacity indicators. The other nice thing about using rasters is that you can take the cumulative risk once you've added them all together, and you can summarize it as per any admin level that you need or any region that you need. So here we just broke down the risk into the state level, sorry, the admin level, and presented the 3 different future scenarios for, or current, and then the 2 future scenarios. The nice thing about doing this way is that you have options in terms of interventions for different level stakeholders. So for instance, field officers might want to look at the individual water stress indicators, and they can look at those and decide where they want to intervene. FAO might come along and look at the malnutrition risk and see these are the areas that are highest at risk, and these are the areas we therefore want to intervene. Whereas government officials might come along and look at the very high overarching state level cumulative risk and say, based on this, these are the areas that we need to prioritize and strategize for. Okay, so there's different input levels, well, access points for these data. There are a lot of challenges, especially when dealing with a lot of this data. Spatially available data is very difficult to come by in some countries. Essentially, there's a few ways to overcome it. Firstly, begging works very well. If you let the clients know that the quality of the data that you get will inform the outputs of this analysis, they are often very quick to try address that. And especially if you do need a ministerial letter requesting data from those national custodians, I would recommend getting that very soon at the start of the process. Otherwise, proxies. If you don't have a data set that speaks specifically to healthcare capacity, you can use proxies that are some way indirectly representative of these data sets. For instance, I very often use infant mortality rates to present general healthcare capacity, just because there's somewhat of a correlation, and yeah, the infant mortality rates are very often available. Alternatively, you can make the data if you feel comfortable with that. So for instance, if you need accessibility to medical facilities, you can do a drive time analysis based on OpenStreetMaps to the facilities. There was a question earlier this morning, how do you deal with data inconsistency, so spatial and temporal mismatches? This is very often the case. Spatial disparity sometimes requires some manipulation, either reprojecting or resampling, or in some cases interpolation of the data in terms of the data. This should only be done with extreme caution, as essentially you are recreating data that doesn't exist. So you just need to be very careful about if you're doing that correctly or not. Sometimes even the best data, if it doesn't work within the scales of your other data, sometimes it's actually not worth using it to compromise the sake of your data just for that extra data. Temporal disparity is always, I've never seen a project where temporal disparity hasn't been the case. Sorry. Obviously, you need to try and get data sets as close together as possible. So 2015, 2017, that's okay. But you always need to note these differences. There are obviously some plugins that are saying that they can forecast the data, but you obviously need to have time series data for this. And I would probably not use GIS for that. I'd probably use ArcPy or R as the statistical function that would likely give much better results. Otherwise, just keep your projection, keep your resolution and format consistent, and also make sure you document all your metadata. One final thing, or two final things. local context. Bear in mind that GIS can only go so far, especially if you are an international expert and you're doing a project in another country. You have to have local expert inputs, and you need to have regular sanity checks with them to make sure what you're doing is correct, and also validate against literature as much as possible. And lastly, with complexity, it's always a good idea to keep it as simple as possible, bearing in mind that your clients, your people looking at this data aren't necessarily technically advanced. So use simple standard legends. Red equals bad, green equals good. Just things like that. Blue means more rain, brown means less rain. Just be consistent and plan your analysis as detailed as you can beforehand within a standard framework, and that should help you a lot. Okay, that's pretty much everything. Sorry, I had to go through that very fast.
Thanks so much, David. That was really interesting, and thank you for that brief introduction to what I know was quite a comprehensive V&A in Nigeria. Thanks for sharing all the challenges and recommendations. I think it was very useful. We're a little bit behind on time, so I'm going to hand over to our next speaker, Dr. Yao Etienne Kouakou. So for a researcher from the Swiss Center for Scientific Research in Côte d'Ivoire. Now, this presentation, I understand, will be in French, so if you need French interpretation, set that up now. And donc, je passe à Etienne. Etienne? Ah,
Oui,
parfait.
désolé, mon micro était fermé.
Pas de problème.
Ok, merci pour la parole. Je suis très heureux de participer à ce webinaire et également heureux de partager l'expérience de la Côte d'Ivoire. Alors, j'ai été déjà présenté, nous sommes déjà en retard, donc je vais aller rapidement. Alors, je vais tout d'abord présenter la zone d'étude et puis le problème, c'est pourquoi on appelle l'étude en même temps, la méthodologie et puis présenter les résultats en 2 étapes. Alors, donc, ici, vous avez la zone d'étude. En fait, c'est une étude qui a été menée dans le cadre de création donc de l'adaptation au changement climatique dans le développement de la Côte d'Ivoire. Donc, le pays veut intégrer le changement climatique dans ses programmes. Et donc, il y avait 5 secteurs prioritaires, les sols, les ressources en eau, les ressources côtières, l'agriculture et puis la santé. Et donc, nous avons conduit donc l'évaluation, il s'agissait dans ces secteurs-là. Donc, comme vous pouvez le voir ici, voici, c'est le pays qui est là. Et donc, l'étude a été menée à l'échelle des districts administratifs du pays. Donc, vous voyez, c'est les districts qui sont là. Et il faut reconnaître aussi que ici, des études ont montré que le pays, le climat varie d'une zone à une autre. Donc, on a 4 zones climatiques dans le pays. Ici, vous avez la limite donc, de la première zone climatique. Et là, c'est la 2e zone climatique, la 3e zone et la 4e zone climatique. Et donc, dans l'étude, compte de tout ça, je pense que les premiers orateurs ont bien spécifié cela. Et donc, il s'agissait pour nous donc de voir à l'échelle du pays les zones les plus à risque au niveau de certaines maladies. Donc, après échange avec les experts de la santé et tout ça, il y avait 3 maladies qui ont été retenues. Mais pour des problèmes d'accès aux données, nous avons retenu 2, notamment le paludisme et les maladies diarrhéiques. Alors, tout a commencé d'abord par l'analyse de la chaîne d'impact de ces 2 maladies-là. Donc, je vous présente ici la chaîne d'impact du paludisme telle que nous l'avons conçue dans cette étude. Donc, vous avez ici, vu que le risque, il est fonction donc de l'aléa climatique, de l'exposition et de la vulnérabilité. Et donc, vous avez ici aléa climatique que nous avons appelé le danger, l'exposition, Donc, nous avons choisi de mener l'étude enfin, après lecture des différents documents. On a vu que les femmes enceintes et les enfants étaient les plus exposés. Donc, c'est eux qui ont été pris en compte dans cette étude. Et puis là, vous avez l'aspect vulnérabilité, et tient compte de la capacité d'adaptation et de la sensibilité. Et après, le tout va dans le risque. Et donc, pour chaque bloc, que ce soit l'aléa climatique, l'exposition, vous voyez dedans, on a identifié des indicateurs qui sont mesurables. Et à partir de là, nous allons collecter les données au niveau de chaque district, comme je vous ai présenté tout à l'heure. Et donc, nous avons eu à collecter les données climatiques, température, pluviométrie, des données sanitaires, des incidences sur les maladies qui ont été choisies. Et comme les gens l'ont dit tout à l'heure, c'était pas facile d'avoir ces données-là à l'échelle du pays. Et donc, on a eu aussi recours à des sites Internet, aussi les données sur les populations et les caractéristiques aussi des districts que nous avons dans les documents au niveau national. Et après ça, vu que les données sont de sources multiples, tout à l'heure, mon prédécesseur l'a dit, il fallait donc harmoniser, standardiser les données, donc les ramener à la même échelle. Il y a eu des experts qui ont donné des poids aux différentes variables que nous avons retenues. Et puis après, tout ça, on a combiné pour calculer donc le risque. Voilà. Et donc, tout ça, c'est fait au niveau district administratif. Alors, ça a donné comme résultat. Déjà, comme on vous l'a dit, on a d'abord en amont analysé les relations donc, entre et les maladies, l'incidence de ces maladies. Donc, il y a évidemment un lien entre les deux maladies, le paludisme et la diarrhée. Il y a des liens entre ces deux maladies et les paramètres climatiques qui ont été choisis. Donc, ici, voici un peu à l'échelle du pays, voici comment la pluviométrie varie. Donc, en passant de l'est à l'ouest, la pluviométrie augmente. Donc, il pleut beaucoup plus dans ces zones-là par rapport à ces zones qui sont ici. Au niveau des températures, c'est le sens contraire. Donc, en passant de l'est à l'ouest, les températures vont diminuer. Donc, ça, c'est l'analyse donc, de la température au niveau national. C'est important d'avoir tout ça. Et donc, avec tout ce que je vous ai dit en haut, nous avons pour le risque actuel, c'est-à-dire le risque courant, au niveau du paludisme, voilà un peu ce que nous avons obtenu avec les valeurs ici. Donc, les zones qui sont les plus, on va dire, ont des risques intermédiaires. Voilà, c'est ces zones qui sont ici et là. Et ici, en même temps que nous présentons l'évolution du risque au niveau du pays, nous avons aussi la vulnérabilité, une autre forme de représentation que nous avons fait pour voir qu'est-ce qui est plus au niveau donc, des trois composantes de l'analyse du risque. Donc, il y a l'exposition, il y a la vulnérabilité et puis il y a le risque climatique. Donc, vous avez les différentes couleurs en bas ici et on les a représentées à travers des petits diagrammes sur euh, des petits cercles que vous voyez ici sur la carte. Donc, par exemple, ici, vous voyez que le risque climatique, il est très important ici. Dans carrément la moitié du spectre. Donc, le risque, il est élevé, justement parce qu'il pleut trop dans cette zone par rapport donc, à la maladie. Puis, nous avons donc la vulnérabilité également qui est quand on vient, par exemple, ici, on voit ici que l'exposition ici est plus élevée et après, la vulnérabilité et le risque sont assez moindres. Par rapport à la diarrhée, ici, c'est les zones qui sont ici en rouge, qui sont les zones les plus à risque de maladies diarrhéiques et également les vulnérabilités et les trois paramètres du risque qui sont là. Donc, pour chaque zone, on arrive à voir sur la même carte euh, toutes les informations. Alors, à partir de là, on a essayé de voir le futur en projetant les paramètres climatiques et également la population. Donc, le risque, il ne change pas, sont toujours les mêmes. Ouais, ici, on voit que le danger va encore augmenter ici. La vulnérabilité augmente encore ici. Voilà. Je prends juste cet exemple-là parce que c'est les cas les plus extrêmes. Et pour les maladies diarrhéiques également, on a aussi ces résultats qui sont là. Voilà comment ça, le risque diarrhéique par rapport à l'état actuel est diminué. Donc, c'est quelques zones maintenant qui restent par rapport à la première carte que j'ai présentée. Et puis, voilà, on a la vulnérabilité. Par exemple, ici, ça a été réduit un peu par rapport à la première carte. Et voilà, toutes les informations sont sur cette carte. Donc, c'est juste ce que je voulais dire. Ça rassemble un peu toutes les présentations qui ont été faites. C'est beaucoup de données qu'il faut tracer. Donc, il y a des difficultés, surtout l'accès aux données. Donc, il y a beaucoup de pourparlers qu'il faut avoir, surtout les données de santé. C'est pas facile de les avoir. Après, il faut avoir les bonnes données et tout ça. Donc, nous sommes en processus de projet précisément, et il faut s'y prendre très tôt par rapport à ces données-là. Sinon, si vous avez un projet dans un délai, ça risque de vraiment traîner. Donc, voilà ce que je voulais partager par rapport à l'expérience de la Côte d'Ivoire. Je vous remercie.
Merci beaucoup, Dr. Etienne. So we have a few minutes left for discussion and Q&A. So I'll hand you over in a second back to Dr. James Chirombo to facilitate the discussion. So if you have any questions, raise your hand and you can unmute and we can answer your questions to any of the presenters today. Otherwise, we may address some of the questions in the chat as well. So James, over to you.
Thank you very much, Amy. So the floor is open. If you have a question, raise up your hand and I'll give you the floor to comment or to ask. They'll say, yeah, you can also type in the chat. We'll be able to address your questions.
James, can you see the hands? I can see Janito has his hand.
Yeah. Janito, go ahead. I've seen your hand.
Hi, everyone. Thanks, James, and everyone else. I actually it's a question from myself. It's like, how do you? I mean, I've looked at some of the presentations that have been made. This is not specifically to you. The question is for everyone else. I've seen that you have shared some of the future climate world claim, I don't know how to call it, but how reliable are these? How do they evaluate? Because I think for the climate side of it, the model is considered to perform well if they can perform well for historical data. How was that data? I mean, downscale, because it comes from a global model. Is that a statistical downscaling? Was a dynamical kind of thing? Maybe David as well can try on that. Over. Thank you.
All right, thank you. So David, don't take this one.
Yeah, sorry, I couldn't work out how to raise my hand. Yes,
Okay.
Janito, that's a very good question. Wellcome is great, and it is based on the IPCC latest AR5 scenarios. It does go down to 1 kilometer, which I think is exciting, but I don't think it's entirely accurate. You got so many microclimates down there. I wouldn't go that far. I tend to use, I think, the 2.5 minutes, which is I think about 50 kilometer resolution data. So I mean, yeah, but they also are, in terms of the validation, there are multiple models. So I wouldn't recommend using just the ensemble. You can look at the different ones. So for instance, in South Africa, I know the HAD model works particularly well in the Western Cape, but is not very good in other places. So yeah, it's a bit of a complex thing, but the data is good, but I wouldn't use the 1 kilometer resolution because I think I don't think it's accurate.
Right, thank you very much. Any more questions?
There is one for David in the chat. I don't know if we want to address that one. Just asking if there's any publication or report, particularly describing the methods that were used.
I don't know if the client wants me to give that out yet. I can share it with you afterwards. But yeah, it's still being assessed currently.
Right, thank you. Any more questions from the audience? I can't see another hand. Maybe I'm looking at the, okay, there is a question in the chat. Or maybe it's a comment. So let's see if I can read it. So a request to David, great presentation of the work you have done. Do you have any publication/report that I can read from the analysis you did, especially that describe the methods used?
Yeah, I just
Oh,
replied
it's
to
already
that.
answered. Okay. All right. Okay. Thank you.
Yeah, I don't know if the client wants me to share everything yet, but I'm happy to share what I can if you email me.
Let's see if there's another message or question. I can't see another hand.
I think we're almost out of time in any case. I don't think we have many questions. A lot of them we've already answered in the chat. So if there's no burning questions, we can probably move on to the final. So thank you very much, James, both for your presentation and for the facilitation of the very brief Q&A. We didn't have a lot of time. I'll just quickly share my screen. Just as a quick reminder of the upcoming webinars. So the next one is on climate resilient and environmentally sustainable healthcare facilities. And then as James mentioned, we do have another one coming up in July, the week after, on quantitative approaches for V&A assessments. So looking more at sensitivity analyses and projecting future health risks. So we do encourage you to, of course, attend the webinars. And as already mentioned, they are recorded and we'll put them on the website, and all the previous webinars you can see in the list here are on the website. I really want to give a very big thanks to all our presenters today and to all of you for your engagement, your participation, the conversations in the chat. And if you have any questions, just do contact us, and thank you very much and have a good day or evening wherever you are. Thank you.
Thank you.
Merci.
Thank you. Thank you.